Let's see. How do we do this now? Is there a... just next slide? Okay. Nice, nice. Okay. There's a reason I didn't go into cardiovascular surgery but cardiology, because it takes no dexterity to go like this and then prescribe pills. So, okay, let's skip this one. Why are domestic and international health issues, political issues, policy issues, a priority for an Ivy League institution? We're not a public institution. Why are these kind of issues a priority for Cornell? Because they are, and they have been for decades and decades. Let's start by reviewing, just quickly, reminding ourselves what the core missions are of our university and how this fits in with global health. First of all, the university was established for undergraduate and to some extent graduate education, and has gone on for to be a big presence in professional and continuing education. And more recently than the university was first established 145 years ago, research and scholarship and the kind of creative activity the humanists and artists do have become more and more a part of the university's scene. Preservation and dissemination of knowledge is a very, very important aspect of universities, and the greatest library systems in the world are all associated with universities of one sort or another. And then increasingly, public engagement, including extension and other so-called land-grant functions. Cornell is the only private university in the country that does the land-grant functions for its state, the state of New York. And there's even an organization called the Association of Public and Land-Grant Universities that we belong to, along with 217 other institutions, and we're the only private one in there. But you take it further, and the faculty and students and staff at Cornell act as though we're not just the land-grant university for New York State, excuse me, we act as though we're the land-grant university to the world, and it's one of the things, one of the many things that was hugely attractive and exciting about being a part of this community for me. Global health is an important area of education, an important area of discovery, an important area of service in every part of the university. It's interdisciplinary, a word that we use so much it's gotten to be a cliche, but this is one of the real interdisciplinary fields. It's a vital area for outreach and service, and capacity building, which from my point of view is the main thing that's important about global health beyond the immediate delivery of care, preventive care and diagnostic care, and hopefully curative care or at least comfort, is capacity building so that individuals in a particular culture and institutions in that culture can develop the capacity to solve their own problems and be the arbiters of which problems should be solved. And one of the themes that will go throughout my presentation today is that we have to resist a paternalistic point of view as a rich institution in a rich country, that we understand the problems around the world, and we will come and tell you and you and you and your particular culture which problems need to be solved and even how to solve them. Our job ought to be, and it's a great example in the work that Dr. Johnson and this medical school are doing, for example, in Mwanza, Tanzania, that what we ought to be about is capacity building of individual institutions and individual people. I'm going to start by splitting up the global health initiatives that are already very active at Cornell into three categories: those that are based in Ithaca, those that are based here at the medical college, which I'm sure, of course, you know a lot about, and those that are across the university. So I'm going to go through the Ithaca ones in a little bit of detail because I was assuming that you may not be aware of some of these, and then I'll go through the Weill Cornell ones a little more quickly because I'm sure you're aware, and most of you much more cognizant of them than I am. Global health research and education is a priority, and up north, when the so-called Life Sciences Task Force about a decade ago or a little bit less was looking at the so-called new life sciences on the Ithaca campus, they recommended developing a major in global health. And we haven't gotten there yet. As you may know, it's a minor, but a lot of progress has been made. And it's an area uniquely suited to Cornell's expertise. Cornell, as you may be aware, the Ithaca campus is one of the great campuses for the sciences, especially the physical sciences. Cornell last year, again, was the #1 recipient of National Science Foundation funds in the United States. Name your favorite school, Caltech, MIT, Berkeley, you name it, and there's more NSF money in Ithaca than at those schools. But that campus had focused the life sciences expertise more in agriculture and life science and veterinary medicine, and about a decade ago decided to put a big thrust on life sciences throughout the Ithaca campus and to link more closely with Weill Cornell Medical College. Dr. David Hadjar, who may or may not be here today, if you see him, pound him on the back about the good work that he did in getting the basic expertise at Ithaca together with the massive expertise on this campus to push forward in that fashion. But among all of the molecular biology and genetics and those topics that are so critically important, this task force did talk about a major in global health as a reflection of a lot of things going on in Ithaca and, of course, at Weill Cornell. Here's a few examples, just examples, not a comprehensive review of some of the global health work going on that's based in Ithaca. The Agua Clara project is a project, as you can see, of engineering students who design and build water treatment plants for rural communities in Honduras. And the students visit sites during winter break, and the 5th full-scale facility is under construction this year. It's been a very, very active project and one that's directly involved engineering students. Ratan Tata, who is a Cornell alum of the architecture program, and now the head of the Tata Group, the largest industrial conglomerate in India and one of the largest ones in the world, is a current trustee of Cornell University and very, very engaged with us in global health. And a trust that was established by the Tata Group has funded with an endowment, an initial endowment of $25 million, an initiative in agriculture and nutrition. And we are focusing on child nutrition and anemia and bringing together expertise in Ithaca in economics and nutrition and soil science and hydrology and animal science. And you'll be hearing more about that as time goes on. The Gates Foundation has funded a $27 million project through the College of Agriculture and Life Sciences in Ithaca to combat stem rust, a fungal disease of wheat. And 90% of the world's wheat stock is susceptible to this microbe. And so it's a 4-alarm emergency to do something about this through plant breeding techniques and other modern agronomy techniques. And we're the head of a 15-center worldwide effort funded by Gates to combat and prevent a loss of the world's wheat stock, the main staple in the world, based on stem rust. The so-called CFAD, the Cornell International Institute for Food, Agriculture, and Development, is a long-standing group of faculty and students and staff in Ithaca and elsewhere. Warren is very closely connected, as many other faculty here are, to the leadership of this. Dr. Alice Pell, who's the Vice Provost for International Relations, and many others. Just one recent grant that was received, a $3.2 million National Science Foundation grant to tackle graduate students, to train graduate students to tackle food systems and agriculture problems. And the field research is being done in Kenya and Ethiopia in partnership with ILRI, the International Livestock Research Institute. That's Chris Barrett, an economist at Ithaca, and he's the one with that goofy smile on, and a very, very interesting man that I hope you have a chance to interact with.